Started your 2 minutes time.
Can I start, ma'am?
No, wait for your time.
Okay.
Just wait, okay? Start it.
Okay. Hi, I'm Geeta. How are you, are you Linda Estevan?
Yeah, Geeta.
Mm-hmm. Yeah. Linda, you can call me Geeta. Linda, I believe that you have a difficulty in managing a case. So I'm really sorry for that. So how are you coping with that?
Actually, Geeta, it was such a means I don't know how I can miss out on all these things. I really felt bad about the poor patient. It was a very busy
Mm-hmm.
day, but yeah, difficult for me.
Yeah, don't be upset and don't be tough over yourself, Linda. Uh, we all are here in the learning phase. We all make mistakes, but good thing is to learn from that, so that mistake do not repeat again. Okay.
Okay.
Do you feel that anybody say like that you are not a good doctor or anything like that, or
No,
any?
no. Nobody
No.
has no.
Okay.
Nobody has said
Okay.
anything, but it's me only. I am
Mm-hmm.
not happy with my own self because it's killing me. That how can I
Yeah.
do this mistake? It's killing me.
Yeah, so don't worry, Linda. I'm just here to help you out. We will. So today, we will discuss about the. I believe that you want to know about the reflective practice, right?
Okay, yeah.
Mm-hmm. Yeah. So anything particular that you want to know in reflective practice?
No, actually, I just wanted to reflect on myself. What exactly I could
Mm-hmm.
have done good.
Yeah,
How could
surely. Mm-hmm. Yeah, surely, Linda. So I will discuss with you about what are the basic principles of reflective practice, what are the legal aspects when we enter it in the e-portfolio, and what is its importance for the ARCP. Okay, we will also discuss about your patient that you have managed. Okay, Linda.
yeah, definitely, yeah.
And yeah, and Linda, in between, if you feel any difficulty, if you want to ask me any question, you can stop me and you can ask me again. Okay.
Okay.
Yeah. So Linda, have you ever done any reflection before?
No, I have just joined the department and I have just completed few months of my rotational
Mm-hmm.
duties. Not yet
Okay.
reflected on any task.
Okay, so no worry, I will definitely help you in that. Yeah, so Linda, reflective practice is very important. It is when individual is trying to retrospect their own actions, that what they have done good and what they have done wrong, and what so that these mistakes do not repeat it again. Okay, it is not just an exercise to assign blame to anybody. It is just to improve the patient care and improve our practice as well. Okay.
Okay.
Yeah. So Linda, as far as ERCP is concerned, so it is mandatory for the progression from one year to another. These reflective practice forms are required. At least 8 reflective practice are required for the progression of a year to year. Okay.
Okay.
Yeah, so reflective practice form, they are we have to fill this in the e-portfolio. But before that, it is good to it is always advised to discuss with the education supervisor about the case. Okay.
Okay.
Yeah. So I'm coming over the reflective practice form. So in this reflective practice form, there are we have to mention over the date. We also have to mention about the this is the form. We have to mention about the area of reflection.
Okay. Okay.
Yeah. Okay, like whether any clinical skill you want to your area of reflection is clinical judgment, like you have to take
Okay.
over that. Okay.
Okay. Yeah. Yeah.
So
Yeah.
now could you tell me about your case that and after that you have to write about the brief summary of the case or the clinical situation, what exactly was. So could you please tell me about the patient?
Actually, yeah, this patient who is actually a 52-year-old Mrs. Lisa Duncan, she had
Okay.
come to the emergency. She had an emergency appointment because she had heavy bleeding after 8 months of stopping her menses. So GP has given her an urgent referral.
Okay.
When she came to the emergency, by that time her bleeding has been settled, and the labor ward and the situation was so tight that I didn't get time to see this patient. Although I sent her hemoglobin was at that time 9 gram percent. So I had given her
Okay.
iron tablets. And then I just thought that it is postmenopausal, means it's just a bleeding episode, and Myrina will fit her and it will solve her problem. I had discussed the option, but it was very heavy, very difficult to manage the routine things. So we had decided to come after 6 weeks routine appointment for Myrina insertion. And with that plan, with iron supplementation, I sent this patient back. After
Yeah.
4 weeks, she had another bout of heavy bleeding and she reported to the
Okay.
emergency. At that time, when my ST4 was examining her, he has noticed that there is a fragile, big cancerous growth for which the biopsy was
Okay.
taken. And it was adenocarcinoma of cervix actually. So I missed out, I grossly missed out. A simple examination could have avoided this situation.
Linda, please don't feel like that. It is good thing that you are realizing the mistake. And it is a good thing that you learned from this mistake. Okay. So could you tell me that whether you asked her about the cervical screening, that whether it was done?
Yeah, that was another issue. Actually, the cervical screening was done a year and half back. It was showing
Okay.
normal, but after this biopsy, they had reviewed the slides and they said that there was few abnormal cells which was missed actually. They said that.
Okay. Okay, fine. Okay. Okay. And what, have you asked that what she has taken treatment for this issue, misleading?
Yeah, she had been referred from GP to us actually for the bleeding treatment.
So previously she has taken any treatment for this issue, like as she was, for how long she was having the bleeding?
It was just
Have you
for
asked
8,
that?
10 days. 8, 10 days only she was having a bleeding. And for that she has reported. The GP has made an urgent referral. Only I made a
Okay.
mistake by not examining her and not offering her a treatment. I only made a mistake.
Okay. So don't blame yourself. Okay. So that's really good thing that you have taken a very good history. You have asked her about her bleeding. You have asked her about the smear as well. You realize that it is good to send see complete that count to know the amount of the hemoglobin, that you have really did good. So what do you think, Linda, that what you have learned from this case?
Yeah, I have just learned whatever will be the situation, however busy will be the
Mhm,
labor board or the routine
mhm,
cases, whenever patients come to you with red flag signs, a postmenopausal
mhm,
bleeding, we should
mhm.
examine them. That is my big learning lesson from this case.
Yeah, yeah, you are right. You are right, Linda. It is mandatory that any patient come like with this. It is good to always do the speculum examination. And if you think that the emergency duty is going so busy, in that case, you can also discuss with your consultant about the for any extra help. Even if you feel any difficulty in the management, you can ask your consultant as well as on the telephone.
Even I thought that I should have asked someone to come and
Mhm,
assess this patient. Would not have had caused the
mhm,
delay in management for her. Actually, I'm really feeling very sorry for the patient, and
mhm.
it's not a
No.
pardonable mistake from my side also.
So, but a good thing is that you have learned that in the next time when any case will come with this heavy bleeding, it's good to do full examination and to advise some few investigations
Yes,
and to discuss with the consultant, right?
yes. Yeah,
Mhm.
yes.
So, what would you do differently? Yeah. So, has this experience highlight any deficiency in your training? What you think?
Uh, no, I don't think any deficiencies for this, but yeah, I have reflected and I need to give importance to the clinical examination also.
Yeah, you are right. It is we can we can improve the deficiencies in training by doing the go through the theoretical topic as well, like postmenopausal bleeding with when patient come with the postmenopausal bleeding, then at the same time the management should come in our mind. So it is good to go through the theoretical knowledge as well. Okay.
Okay. And what about these legal problems? What are the legal things associated with this reflection?
Legal things are have you so for legal thing is that it is very good thing that go to the patient, talk with the patient that what went wrong